Evaluation of the effects of an artificial intelligence system on endoscopy quality and preliminary testing of its performance in detecting early gastric cancer, a randomized controlled trial. Introduction. Esophageal-gastro-duodenoscopy, EGD, is widely used to examine upper gastrointestinal lesions. White light imaging, WLI, endoscopy, is a standard protocol for examining gastric lesions. However, the performance of endoscopists varies greatly, leading to a miss rate of 20% to 40% for early gastric cancer, EGC. Endoscopy diagnosis is subjective, operator-dependent, and varies widely with experience, reducing the detection rate of EGC and precursor lesions. There is an urgent need to improve endoscopy quality and reliability. To achieve such improvement, a large number of guidelines have been issued, and consensus of expert opinions in specific areas has been reached. Safety and quality indicators for EGD have been proposed by the American Society for Gastrointestinal Endoscopy and the American College of Gastroenterology. The first evidence-based indicator of EGD performance was proposed by the European Society of Gastrointestinal Endoscopy, ESGE, in 2015. The standard procedure is to examine all parts of the stomach during EGD, with a recommended examination time of 7 minutes. However, due to the lack of monitoring and available tools, adherence to protocols is often not very high. A practical and workable approach should be established to implement guidelines for routine endoscopy. In the past few years, deep learning has made remarkable progress in the field of medical image recognition. Most studies are dedicated to the use of computer-aided diagnosis of lesions. However, whether deep convolutional neural networks, CNNs, can be used to monitor the quality of routine endoscopies has rarely been explored. In a previous study, the research group developed a novel artificial intelligence, AI, system called YSense based on deep reinforcement learning, DRL, and CNN. YSense demonstrated the ability to monitor blind spots, gastric areas overlooked during EGD, and generate photo documentation in real time during EGD. In the present study, the authors updated the YSense system by integrating a previously trained real-time EGC detection model and named the updated system EndoAngel. They then carried out a multi-center randomized controlled trial, RCT, to verify the ability of EndoAngel to improve EGD quality in 5 hospitals and to describe its performance in detecting EGC in the clinical setting. Background. EGD is a prerequisite for detecting upper gastrointestinal lesions, especially EGC. An artificial intelligence system has been shown to monitor blind spots during EGD. In this study, Wu et al. Updated the system, EndoAngel, verified its effectiveness in improving endoscopy quality, and pre-tested its performance in detecting EGC in a multi-center randomized controlled trial. Methods. EndoAngel was developed using deep convolutional neural networks and deep reinforcement learning. Patients undergoing EGD in 5 hospitals were randomly assigned to the EndoAngel assisted group or to a control group without use of EndoAngel. The primary outcome was the number of blind spots. Secondary outcomes included performance of EndoAngel in predicting EGC in a clinical setting. Results. 1,050 patients were randomized, and 498 and 504 patients in the EndoAngel and control groups respectively were analyzed. Compared with the control group, the EndoAngel group had fewer blind spots and longer inspection time. In the EndoAngel group, 196 gastric lesions with pathological results were identified. EndoAngel correctly predicted all 3 EGCs, 1 mucosal carcinoma and 2 high-grade neoplasias, and 2 advanced gastric cancers, with a per-lesion accuracy of 84.7%, sensitivity of 100%, and specificity of 84.3% for detecting gastric cancer. Conclusions. In this multi-center study, EndoAngel was an effective and robust system to improve the quality of EGD and has the potential to detect EGC in real time.